Hey guys, Phil here, Doctor of Physical Therapy. Today's video is going to be a little bit different. We're going to talk more about physical therapy, and we're going to give you 5 reasons why most people fail physical therapy. But first, we have to understand what the role of physical therapy is in the medical field. Physical therapy in the medical world is in charge of rehabilitation, so getting you to feel better without invasive treatments like injections or surgeries. So when you get injured, sometimes you go to the doctor, you get an x-ray or some type of scan. If the doctor doesn't feel like surgery or injections are warranted, they'll send you to physical therapy first to see if you can rehab your injury naturally. We're all human. You've probably gotten injured at some point in your life. Sometimes if the injury is bad enough, say maybe you've had a fall and now you can't even put weight on your leg, or maybe your back is in so much pain that you can't even get out of bed. In cases like these, it might be good to go to the doctor to get a scan to make sure everything is okay and there's no need for further interventions. This is what people don't realize is most injuries are not at that level. And even when you go to the doctor, they'll give you 3 options: pain medication, injections, or surgery. Physical therapy is like the first line of defense. Is what you do first until you escalate further by going to the doctor requiring more care. And let's be honest, a lot of injuries and aches and pains come and go. It could be something like an old back injury that would flare up once in a while if you kind of overdo it, or it could be some knee pain that flares up once in a while. And these types of injuries are the toughest for the medical system because the medical system is good at treating emergencies. So if you've broken your leg, they'll put a cast on you, or sometimes they'll even do surgery and they'll kind of fix it. But these types of injuries that come and go, that kind of flares up once in a while, is the bread and butter for physical therapy. So the role of a physical therapist is to get you better naturally without these more invasive treatments. So now let's get into the 5 reasons why people don't get better in physical therapy. Number 1, not being compliant. So compliance just means, are you following what the physical therapist is suggesting or telling you to do? When you go to a physical therapist, you'll likely get an assessment and a diagnosis of what is going on and what you need to do to get better. Sometimes that involves some type of exercise program and also some activity modifications so that you don't keep aggravating your symptoms. So it could be something as simple as, I want you to do these 3 exercises 3 times a week, or it could be about avoiding certain movements throughout the day. But the reality is behavioral change is tough. It's hard to change habits. If you look at any self-help section of any bookstore, you'll see tons and tons of books about behavioral change and how can you build better habits, how can you avoid bad habits. It's tough. People are busy. Sometimes they don't have time to do their homework. And so sometimes it's also about finding a realistic goal for you and your patient. And guess what? If you don't follow the plan that is proposed by a physical therapist, that can delay your healing and things can just take a little bit longer. Reason number 2. Over-reliance of feel-good treatments. First, we have to define what a feel-good treatment is. A feel-good treatment is anything that feels good. So it could be anything like massage, acupuncture, cupping, chiropractic, dry needling, ultrasound, e-stim, ice, heat, laser. So basically anything that is designed to take away symptoms or reduce symptoms to make you feel better. So these things are typically more passive, meaning you're just laying there and somebody is doing a treatment on you. So the goal of feel-good treatments is to help reduce symptoms, and there is nothing wrong with that. In fact, sometimes these things can be tremendously helpful to getting your pain levels down so that you can really start moving and getting stronger and getting better. However, if that's all you're doing is getting massages, all you're doing is getting cupped, that sometimes is just a band-aid solution to a longer term problem. For example, if your foot hurts after every time you play pickleball, you go get a massage, it feels better, but then you just go ahead and play again the next day and you re-aggravate it. You end up in this cycle of just re-aggravation and things kind of get stuck and it doesn't really get better. So the moral of the story is these things are good, but if that's all you're doing, then it might become a problem. Number 3, the rehab program is not progressive enough. Simply put, if you have athletic goals or active goals, say maybe you want to be able to play pickleball or you want to be able to run or even just walk, if you're not being challenged by your rehab program, that sometimes means you won't get better as quickly. The body is very adaptive, especially in the musculoskeletal systems. So if you go to the gym and train 5 times a day for weeks on end, you're going to see results. And anybody who has dabbled in the gym would tell you it takes longer than you think. and it takes progressive overload, meaning every week, every month, you're adding more weight, you're adding more reps, you're eating better. So all these things add up to help build a stronger body. But the sad part is sometimes even in my own experience working at some of these clinics, they don't even have the equipment to adequately challenge their patients. Sometimes the heaviest weight you can find at some of these old school clinics is 10 pounds. I've also found that sometimes the same patients are coming in 3 times a week to do the same exact routine. Personally, I feel like that is a waste of time because if you're not progressing, you're doing the same thing. If you know your exercises, you can just do it at home. It's just not the most effective form of physical therapy when you're just kind of repeating the same routine for months on end. So make sure your rehab program changes and it kind of gets harder. Number 4, not giving PT enough time. Things take time to heal, and sometimes things take longer than you would think. Yes, there are some conditions that quickly improve within a couple days, but most things can actually take a little bit longer. A common misconception with physical therapy is that we're just a quick fix treatment. You go in, you get massage, you get some exercises, and boom, magically you're healed. Honestly, I wish it was that easy. Especially if you're dealing with something more chronic, it can take months or even up to a year for things to heal. So it's really important for you and your physical therapist to work together to develop a plan for you to get better. It could involve things like modifying your workouts and of course developing a progressive rehab plan to get you stronger and get you feeling better. So here's an example. Maybe you like to run and you want to get back into running, but something is bothering you. The rehab plan might look like maybe we'll have to reduce the miles that you're running every week by 50%. Maybe we'll suggest running every other day instead of running every day. And we'll start incorporating strengthening exercises 3 times a week. And over time, we'll progress your program so that you can tolerate running every day and getting back to being 100%. This process could take a minimum of 4 to 6 weeks, up to a couple months. Another thing is sometimes it takes a couple weeks for you and your physical therapist to figure out what is going on, because sometimes patients are not bodily aware and they don't even know what are the triggers of their symptoms. They don't even know or recognize what movements they should avoid. So it becomes like this dialogue back and forth with your physical therapist to figure out the pattern of your injury and a truly customized plan for you to get better. So this whole discovery period can take a couple weeks, and then you start your rehab program, which would take even longer. So give it some time, trust the process. It's not a magical treatment. And number 5, sometimes PT is not enough. That could be a hard pill to swallow for some people, but the reality is physical therapy is not going to fix everything. If you need surgery to repair a bone, you're going to need surgery. Sometimes after trying physical therapy for a couple months, you follow the rehab exercises, you modify some of your activities so that you're not aggravating your symptoms. So you are doing all the right things, but things still don't get better. Sometimes you need something extra, and that could be pain medication, that could be injections, or even surgery as last resort. And for something like broken bones that needs immediate attention, surgery is what you're going to need. You're going to skip all the rehab. You're just going to go straight to the doctor and get that fixed. So we have to realize that physical therapy doesn't fix everything, and it's not for everything, but that's why we have all of these other options. So I hope you learned something about physical therapy and why sometimes it doesn't work for people. I wish you all the best and take care.